Why are there not more people talking about the Tuskegee Syphilis Experiment? Imagine being told you were receiving free healthcare, only to discover it was a cruel lie. This is the heartbreaking reality of the Tuskegee Syphilis Experiment, a dark chapter in American medical history. From 1932 to 1972, the U.S. Public Health Service conducted a study on syphilis in Macon County, Alabama. The study involved 600 African-American men, most of whom were poor and illiterate sharecroppers. These men were promised free medical care, meals, and burial insurance for participating in the study. However, they were never told they had syphilis, a dangerous, sexually transmitted infection. Instead, they were told they had bad blood, a vague term used to describe various ailments. The researchers never obtained informed consent from the participants, meaning the men were completely unaware of the true nature of the study and the risks involved. The Tuskegee Syphilis Experiment stands as a chilling reminder of the harm that can be inflicted when ethical considerations are disregarded in the pursuit of knowledge. The study's impact continues to resonate, serving as a stark lesson on the importance of informed consent, patient autonomy, and the ethical imperative to treat all individuals with dignity and respect. The study's legacy has left an indelible mark on the landscape of medical ethics, prompting widespread reforms and shaping the way research is conducted today. We must never forget the tragedy of Tuskegee and strive to ensure that such a horrific event never happens again. The stated goal of the Tuskegee Syphilis study was to observe the natural progression of untreated syphilis in Black men. The study was led by the U.S. Public Health Service, a government agency tasked with protecting public health. Doctors believed that syphilis affected Black men differently than white men and wanted to study these differences. However, this belief was rooted in racist assumptions and lacked any scientific basis. The study was riddled with prejudice from the start. Instead of offering these men the best available treatment, which at the time was penicillin, the researchers withheld treatment. The researchers wanted to see how syphilis would progress without any intervention. This meant denying the participants the chance to live healthy lives and potentially infecting others. The researchers actively prevented the men from receiving treatment, even after penicillin became widely available in the 1940s. They went so far as to interfere with the men's ability to enroll in other healthcare programs. The Tuskegee Syphilis Experiment spanned an appalling 40 years. For 4 decades, the men endured painful symptoms and debilitating complications from untreated syphilis. Many of the men experienced severe health problems, including blindness, heart disease, mental illness, and death. To ensure the men's participation, the researchers employed deceitful tactics. They promised free medical care, hot meals, and burial stipends. What they provided was far from adequate medical care. The men received painful spinal taps, which were falsely presented as special treatments. The researchers' deception extended beyond the participants to their families. The study's impact rippled through generations, as wives and children of the infected men were also unknowingly exposed to the disease. The study's legacy of pain, suffering, and death cast a long shadow over the community of Macon County. The Tuskegee Syphilis Experiment stands as a chilling reminder of the harm that can be inflicted when ethical considerations are disregarded in the pursuit of knowledge. The study's impact continues to resonate, serving as a stark lesson on the importance of informed consent, patient autonomy, and the ethical imperative to treat all individuals with dignity and respect. If you found this story compelling, please like and subscribe for more in-depth history stories. Your support helps us bring more important narratives to light.